next question here. Ultrasound is not useful in evaluating retroperitoneal hematoma, pneumothorax, renal injury, or a cardiac tamponade. Ultrasound is not useful in evaluating which of these conditions. So, we all know ultrasound is used to look at pneumothorax. We all understand ultrasound is more sensitive than chest radiograph to diagnose pneumothorax. What is the important sign of pneumothorax that you see on ultrasound? In ultrasound, we see what is called as Stratosphere sign or a barcode sign, right? Stratosphere sign or a barcode sign in cases of pneumothorax on ultrasound. We also see what is called as a lung point, the transition between the normal lung and the pneumothorax. Okay, that area is a lung point, and that is an important sign to identify pneumothorax on ultrasound. We can identify a renal injury on ultrasound. We can see the fluid collection, the perirenal fluid. We can also see some lacerations in the kidneys. Cardiac tamponade. By doing the subxiphoid view, right, we could look for collections in the pericardial space. So we can also diagnose cardiac tamponade. So in abdominal injury patients, we do FAST, right? That is basically an ultrasound procedure to look at cardiac tamponade, to look at renal injuries. We do EFAST to look at pneumothorax also. So the best answer here should be what? Retroperitoneal hematomas. They're not that easy to look for these deep-seated hematomas unless they're very, very large on an ultrasound. So retroperitoneal hematoma is one which is very difficult to diagnose just based on ultrasound. CT would be a better investigation to look at retroperitoneal bleeds. Please look at this image. What is this image showing you? This is a seashore. You can see this is the sand, right? And this is the sea that you are seeing. So this is a seashore. When you're doing a lung ultrasound, okay, on a normal lung, the intercostal space, the intercostal muscles that you have, right? So the muscles are hypoechoic, they are dark on ultrasound. So these intercostal muscles, they appear like that sea. They appear like that sea. And the normal lung having air inside, remember air is hyperechoic on ultrasound. Air appears white on ultrasound. Air is hyperechoic on ultrasound, appears white on ultrasound. So this air that appears white in the lungs, this will not be resting. It will be constantly moving, going and touching the chest wall, going and touching the chest wall. So you see this constant shimmering that you see. And this pleura will appear as a white line there. So this is the pleural line. So this constant movements of the lung during inspiration and expiration, the chest wall, right? This is the chest wall area, and the white line of the pleura. This resembles like a seashore. And this normal appearance of lung on lung ultrasound is called as a seashore sign. This is a seashore sign where the lung is compared to the sand, the chest wall is compared to the sea, and this white line is the pleura. So let's understand this seashore sign better. Seashore sign is not seen in any abnormality. It is seen in the normal lung ultrasound, right? It's a normal lung ultrasound finding seen on a M mode of ultrasound. To look at moving structures like lung, right, we go for this M mode, right, motion mode. So when we are using this M mode of ultrasound to look at the lungs, a normal lung with its normal movements during inspiration and expiration, during this normal movements of inspiration and expiration, there is some shimmering within the normal movements of the lung, and that appears like the sand at the seashore. So this lung resembles the sand because of that hyperechoic shimmering that you see in a normal moving lung. This white line of pleura is reflected about this bright area at the seashore. And this chest wall, which appears like a hypoechoic area, is resembling this stagnant sea from a distance. So this kind of appearance, the chest wall, the pleural line, and the lung. The lung resembles the sand at the seashore, the pleural line the bright area, and the chest wall resembles the stagnant sea. So this kind of appearance seen in a normal lung ultrasound is called as a seashore sign. Imagine that there is not a normal lung, but instead there is pneumothorax in the patient. So when we have pneumothorax, when there is air trapped in the pleural space, you would not see the normal movements of the lung during inspiration and expiration. There is no movement of the lung coming and touching the chest wall because there is a pneumothorax in between. So you would not see this seashore sign. So in cases of pneumothorax, instead of a seashore sign, you see what is called as a barcode sign or a stratosphere sign. So look at here, this is the normal lung ultrasound. You're seeing this is the chest wall, this is the pleural white line, and this is the normal lung showing movements during inspiration expiration. We called it what? Seashore sign. But instead of the normal lung, if there is air trapped, there is pneumothorax, there is air trapped within, there is pneumothorax, what happens? This is also air, this also appears hyperechoic. So you see these bright bands of air that are trapped. And do they move the same way as lung during inspiration expiration? No. So do you see the seashore like appearance? No. Instead, these bright bands that are alternating, they give the appearance of stratosphere sign, or also called as barcode sign. So stratosphere sign or barcode sign or absent seashore sign is indicative of what? Pneumothorax. Seashore sign is feature of what? Normal lung. And please look at this lung ultrasound image. So this is the normal lung. You can see that shimmering that you see in the normal lung. But look here, you are not seeing that shimmering, you are not seeing that seashore like appearance. Instead, you see this stratosphere appearance. So this area is the area of pneumothorax. And this transition that is happening, this point of transition that is happening between the normal lung and the area of pneumothorax, this is called as the lung point. Seeing this is very pathognomic of a pneumothorax. Now let's understand how you can suspect a renal injury on an ultrasound. So imagine there is a laceration and some perirenal collection around the kidney. If you're trying to evaluate the kidney, you can see this hypoechoic line within the kidney, and you can see this collection in the perirenal space indicating a renal injury in a patient with abdominal trauma. So that is how you can also suspect renal injury when you are trying to do ultrasound. And look at this image. This is a subcostal view or a subxiphoid view where you are seeing the heart. This is the left atrium, this is the left ventricle, this is the right atrium, this is the right ventricle. Remember, the most posterior chamber of the heart is the left atrium, right near the spine, and most anterior chamber of the heart is the right ventricle. And can you see this collection around the heart? Is this just a pericardial collection? No, this is a case of cardiac tamponade. Why am I saying that? It is not just a simple collection, it is also causing the compression or the diastolic collapse of the right ventricle. So when there is diastolic collapse of the right ventricle, right with this pericardial collection, it indicates cardiac tamponade. So this is how we diagnose cardiac tamponade on ultrasound. So look at this another image of a patient with cardiac tamponade. You can see the chambers of the heart, you can see this pericardial collection, and it is not just a simple pericardial collection. This is also causing the right ventricular collapse, right? So this diastolic right ventricular collapse indicates that the patient is having what? Cardiac tamponade. So that is how we differentiate a cardiac tamponade from a simple pericardial collection on ultrasound. So ultrasound is used to evaluate pericardial collections, cardiac tamponades, renal injuries. It's also very good to look at pneumothorax, but very difficult to evaluate retroperitoneal hematomas. So answer here should be what? Ultrasound is not useful in evaluating retroperitoneal hematomas. What would be better? CT is better, not ultrasound. Clear?